Hey everybody, welcome to Pick Dr. Osborne's Brain. If you're new to the show, we're going to be taking all of your questions about what you can do to overcome brain fog nutritionally, how you can naturally overcome the fogginess, the cloudiness, the inability to think clearly or speak clearly or remember things clearly. If you struggle with any of those problems, today's the day to ask your questions specifically on that topic. So the way you would want to do that is type that into the feed, and we'll do our best to answer as many questions as we can in the next hour. Okay. So Kathy asks, what about fasting for brain fog? So yes and no. For women, fasting can actually make brain fog worse. It's just my experience in the practice in clinic. Women tend to handle long fasts less optimally than men. Part of this has to do with the stress mechanisms and hormones, but a lot of times women have, when they go over a 16-hour fast, an intermittent fast strategy over 16 hours, a lot of times their blood sugars drops tremendously and actually affects the brain fog in the opposite direction. Now, everybody's unique and different in that regard. So if you're trying to do fasting, and you're a woman and you can go longer than 16 and you feel better going longer, that's fine. But if you are dead set on trying to fast, and every time that you do, you end up feeling super tired, fatigued, lethargic, and brain foggy, that's your cue to not use fasting as a strategy. So fasting can work for brain fog and for clarity, especially if you have a major problem in your gut that's driving inflammation to your brain. But again, pay attention to how you feel and don't try to force it if it's not working for you. Does stopping anticholinergics help repair damage? Well, first of all, if you're going to stop any kind of medication, I highly recommend you talk with your doctor about that and have a conversation. But what stopping anticholinergics might do is it might help your bowels work better, because that's one of the primary effects of anticholinergic medications, is they can slow down bowel motility and really create problems there. So would that help your digestive tract? Very potentially, yes. Is vitamin C absorbed in the small intestine? It is. If your intestine is damaged, or if you have malabsorption, can that cause a vitamin C deficiency? It can. Vitamin C can be absorbed more than just in the small intestine. It's absorbed throughout the GI tract. But yes, having malabsorption or inflammation in your intestine, diseases like celiac disease, Crohn's, ulcerative colitis, gastritis, can all impact your efficiency at absorption of vitamin C. Let's see, Joshua says, since COVID, I have found that brain fog seems more common. I'm allergic to anti-inflammatory medications such as ibuprofen. Are there any strong natural anecdotal treatments to quickly reduce inflammation until I'm able to correct the root cause? Some things you might try, Joshua, to support yourself. If you're reactive to ibuprofen, so there's something called white willow, which I have a formula called white willow complex, which contains white willow bark and something called boswellia. Both are anti-inflammatory herbals that affect what's called cyclooxygenase and lipooxygenase. So there's two inflammatory pathways that those two nutrients can impact or affect, and it might be very helpful for you, provided you don't have an aspirin. Some people react to ibuprofen, but others are allergic to aspirin. But if you're allergic to aspirin, I don't recommend white willow bark. Now, the other alternative might be a combination of vitamin C and quercetin. And dosing of vitamin C would be around the 4 to 5 grams per day, as well as the quercetin, 3 to 4 grams per day of quercetin. That combination can have very, very potent immune and inflammation modulating effects. What about galectin-3, Pectisol? Do you use it? So when you ask me about particular things, you have to give me context. Do you use it for what? I mean, Pectisol, a lot of people use as a binding agent. and a detoxification agent. But, without context, Marianne, it's hard for me to give you a good answer. Let's see, Adrian, I've had brain fog for 5 or more years now. I've read your book, followed the diet strictly with no change. I've also been seeing functional doctors in America now for 4 years, do regular oat tests, gut tumor tests, blood work, and still no change. I've had myasthenia gravis for 20 years. I take 250 milligrams of mycophenolate. Was on 2,000 milligrams a day of mestinon. I have a reoccurring yeast problem and Clostridia issue on protocol now, trying to sort out. Any advice? Yeah, work with a different doctor. Adrian, if you're working with people for that long and you're not finding a solution, then you're missing big holes. I would also say that oat testing is very restrictive and limited on the data that it can give you. It's a urine output test, and that can change and alter from day to day very rapidly. And so, although there's some things that are helpful to glean from that type of test, it's not something that I would use to really be all that helpful in monitoring your nutritional status or what you should be doing, because again, the information changes more rapidly or too rapidly. And as far as Zoomer tests, I don't recommend them. The accuracy is in question on many of those. Again, I don't like to talk bad about certain laboratory companies, but just not a lab I would recommend. Does boron cause hair loss? No, not typically at all, Lynn. And as far as a starting dose, anywhere from 2 to 10 milligrams a day. Hopefully you're doing that under the guidance of someone. Let's see, best way to test for heavy metal exposure is pre and post urinary provocation. I got ABV, let's see, 10 years ago and have never been the same. I'm currently seeing a neurologist for possible MS diagnostics. What can I do to better the brain fog? My daughter has them too, and she also has EBV. So you're working under the presumption that you have EBV, and I would argue that if I were to measure every person in the United States for EBV, we would find positive results in 80% of the population. I'm not a fan of blaming EBV on people's health issues. I've just never seen anyone with true EBV where treating the EBV was a necessary thing to make them feel better. That's not to say that you might not have had an event where mono was the trigger for brain fog or chronic fatigue, but it's just simply to say that a healthy immune system can control EBV very readily, and so it generally doesn't require any greater degree of treatment per se. You're probably in mold. If you're being told you have EBV, now, and then there's a caveat to that. So what's your diet look like? Because if you've got MS, it's an autoimmune condition highly linked to gluten sensitivity and grain sensitivity. And if your diet is not, if you're not following no grain, no pain, that might be a fantastic place for you to start. Maybe put a copy or put a link up to No Grain, No Pain for Pepper. And then beyond that, let's say maybe you've already dialed your diet in and you're already following No Grain, No Pain, and you're still struggling. The next step in this particular scenario would be to look for mold. You might be living in mold. Mold is a chronic driving force behind chronic fatigue, and so you should definitely be investigating whether or not that's something that's going on. Foods or supplements to help eliminate inflammation. Can inflammation be eliminated so brain fog disappears? Yes to both. Foods are unique to the person. If you really want to know what foods are driving inflammation, you need to be tested. If you'd like to do testing and your doctor won't do the testing, come visit me at Gluten-Free Society. We have a whole array of lab testing that can be done without your doctor. And one of them is measuring for food sensitivities. Another is to measure for gluten sensitivity directly, genetically speaking. And then the third would be to measure vitamins and minerals, whether you have adequate vitamins and minerals. I love this story. So Velocity Girl says, I read your book and Dr. Wall's book in September and quit dairy, grains, gluten, soy, corn, and sugar. I was diagnosed with MS, couldn't walk, and now I can. I love it. But I had to start a low oxalate diet because of kidney stones and gout. And I read Vicky's, I can't remember her last name, about oxalates, and have been letting that guide me as I go forward on a low oxalate diet too. The brain fog is so bad this week. I'm worrying I'm doing something wrong. I'm also coming off all meds, no more chemo, but it's been a year since that and 6 years since opiates and benzodiazepines. Why is it getting so bad now? Well, if you're coming off of meds, chemo meds, that's certainly even a year out, that could still have some brain implications as far as memory and fog. If you're going low oxalate, you could be oxalate dumping, and as oxalates are dumping, that could also have an impact on your cognitive function. One of the best things that you might consider doing is doing nutritional testing. If you're missing key elements, missing key vitamins or minerals that might impact your memory and your brain cells, sometimes that makes a huge difference, especially with a history of MS. I see a lot in MS where severity of B12 and other B vitamin deficiencies are playing a major role in cognitive decline as well. So that's just an avenue I would encourage. Without testing, if you just wanted to try something and see if it was helpful, definitely get on a really strong B complex. You can use something like our B Complete formula, which is a very potent high dose B vitamin complex. Very common for B vitamin deficiencies to be present in MS that can drive a deterioration of the condition. Why does the humidity increase my brain fog? Most likely mold. When humidity's high, mold sporates. Mold needs water to grow and to replicate. So when humidity's high, there's ambient water in the air that can be helpful for mold to grow and propagate, and mycotoxins from the mold for many people affect their brain as well. You mentioned your inner ear and vertigo. I think that's part of your brain. It's, your inner ear is fed by a nerve called the vestibulocochlear nerve, which is a cranial nerve that is attached directly to your brain. Let's see here. Food or supplements? I think I answered that one. As far as food and supplements, again, foods get tested. Supplements get tested. Outside of that, if you're generally trying to support your brain function, there are a lot of them. If you go back and watch Tuesday's show on brain fog, I talked about magnesium and choline and vitamin C and B vitamins, all playing a super critical role for your brain's ability to make neurochemicals that allow you to be focused and have concentration and good communication amongst your cells. What foods? Okay, I answered that one. Any remedies for brain fog since COVID? So if you're talking about post-COVID brain fog, yeah, a lot of people find that proteolytic enzymes and N-acetylcysteine can be very helpful in those situations. So NAC, anywhere from 1,000 to 2,000 milligrams a day is a good place to start. And then proteolytic enzymes, we have a special blend called Matrozyme, which you take on an empty stomach. And the way that's done is you take 3 capsules twice daily. But that you might give those things a try and see if they don't support you well. Is schizophrenia curable? Depends on what's causing it. In my experience, yeah, it is. I've seen people with schizophrenia not have schizophrenia anymore when they got their nutrition dialed in. There's actually a form of schizophrenia called bread madness, which is a mixture of molds on bread combined with gluten. Gluten can cause the brain to produce, or the body to produce, antibodies against certain tissues in the brain. It's been well documented that schizophrenics commonly have gluten antibodies, and when they go on a gluten-free diet, a lot of times their hallucinations go away and their mental clarity picks up. Is eating brain nutritious? I wouldn't recommend it. I mean, there's a lot of potential issues with, with what's called prion disease, If you've ever heard of mad cow before, mad cow's disease, I just don't recommend eating animal brains because there's a lot of potential prion deposition there that could contribute to human illness. Do you suggest using a blood glucose monitor for a month or two? If so, can you give a suggestion of one to get? They're all pretty good. I mean, just get one that works best for you. And if your doctor will prescribe it, even better. And that way your insurance will cover it. But there's a number of good companies out there that sell CGMs to monitor blood sugar. And a month or two to kind of get a good feel for how what you eat and what you do affects your blood sugar. I don't think people need them indefinitely for the rest of their lives, but a month or two of data can be extremely valuable in the long run for helping you adjust your diet. Does a vitamin C deficiency cause brain fog, lack of concentration, and ability to focus? Yes. Vitamin C is necessary for catecholamine synthesis, so you can't make dopamine, epinephrine, norepinephrine without vitamin C. It also plays a role in serotonin production. So vitamin C, think of vitamin C as like a primary fuel source for your adrenal glands. Your adrenal glands are the little tiny walnut-shaped organs that sit on top of your kidneys that help produce stress hormones that help you compensate for stress. And if your adrenal glands are malnourished of vitamin C, your ability to cope or adapt to stress is going to be diminished. And that's one of the hallmark symptoms of high levels of stress is brain fog. So vitamin C plays a very important role there. Go back, Harry, and watch Tuesday's show on brain fog. We did a whole crash course, and I talked pretty in depth about vitamin C. Is vitamin B12 deficiency associated with pernicious anemia? I'm not sure I understand your question because the wording doesn't make sense. So vitamin B12 deficiency is so pernicious anemia is a type of vitamin B12 deficiency because there's an autoimmune attack against the parietal cells in the stomach, which is a form of gastritis. And gluten can be a cause of that autoimmune gastritis in your stomach. So gluten can contribute to the gastritis that can lead to damage to your parietal cells that leads to the inability to absorb vitamin B12, which is sometimes diagnosed as pernicious anemia. So I don't know if that's helpful for you, but the way you worded your question was a little construed to me. And I think the follow-up to that is, can that be associated with neurological damage? Yes, it can be, because vitamin B12 deficiency can cause demyelinization of your nervous system, and that can lead to all kinds of problems, including conditions like MS, including things like schizoaffective disorders, bipolar disorder, mood swings, irritability, depression, ADHD, and the like. So absolutely. Brain fog after brain surgery and hydrocephalus. How can I make the brain fog better? Is it okay to eat magnesium L-threonate? Yes. Magnesium threonate would be a great supplement, post-surgically. And, depending on the nature of your surgery and how invasive or how big the cut and how much damage was there and why you needed the surgery in the first place, you might want to check out our surgical recovery protocol, nutrition protocol, as a good step as well. We'll post a link of that up for you in the feed so that you can go and read more about it and check it out. But that might be something you want to consider doing as support to recover. But ultimately, again, without the context of why you developed hydrocephalus in the first place, there could be some other things driving neurological brain inflammation that, that you haven't found yet, so it's hard to say for sure. Abdul says, I follow your book. What's your advice for vitiligo? I eat fruit and dried fruits. Is that good for people following your book? You can, but you can overdo fruit, Abdul. A lot of people Overdo carbohydrates is a general rule of thumb, and excessive carbohydrates can drive up the populations of yeast in the GI tract, and yeast specific species, especially like Candida albicans, can produce a protein that mimics gluten. So if you're high carbohydrate with high yeast populations mimicking gluten, and you're trying to overcome vitiligo, it's going to be a tough call, because vitiligo is an autoimmune depigmentation disorder of the skin, and in my experience, gluten is commonly playing a role in triggering or helping to trigger that. You might also consider, Abdul, using vitamin B12 and folate. Some pretty good researchers in South America who have documented some nice repigmentation using B vitamins. And so those may be things to consider just as good support. Could having Crohn's disease cause brain fog? Yes. But so could perimenopause. I mean, one of the things that we see in perimenopause as estrogen levels drop is choline requirements go way up. And I've put a number of menopausal, perimenopausal women on choline with reports of tremendous improvement in clarity and focus and concentration. So you might consider choline an option in that regard. But, Crohn's disease, depending on how long you've been in remission, I mean, Crohn's disease and inflammatory bowel disease causes malnutrition, and any kind of malnutrition could contribute to nutrient deficits that affect your cognition. So in that regard, yes, but part of it depends on how long you've been in remission. Have you had your nutritional levels tested? Something else that you should do if you haven't, because there could be some key insights into brain function through nutrition coming from testing like that. Let's go down on the far left. I have white matter lesions on my brain, undiagnosed to this date, and we've known about them for 15 years. I recently had additional lesions after a horrible bout with my intestines, chronic constipation, and started to figure out the gluten issue. I mentioned to the head neurologist, I believe I'm gluten intolerant, and he acted like I never spoke the words. I'm assuming even though it's now known there's a correlation, it's not yet a diagnosis in the field of medicine. Also, can mold cause brain lesions? Yes. Absolutely, mold. There was a federal case a few years ago. Shelley Frederico sued the federal government. She was and her husband in the military and being exposed to mold in their military base housing. And they proved in that federal court case, that mold actually causes atrophy of areas in the brain. So definitely contributes to brain lesions. Mold can be a neurotoxin. Mycotoxins specifically can affect brain function and damage the nervous system, including your brain. So yes, if you suspect mold, get a good mold inspector out to your house or wherever you suspect you're being exposed to it, and have thorough testing done. Don't note on mold testing, if you hire a mold inspector and they come out and they do an air test, you don't want to rely on an air test. Air tests, in my opinion, are akin in sorts to going to the doctor and just doing a CBC. And if your CBC is normal, the doctor says, oh, everything must be perfectly fine. You can have other things wrong. And air tests can be highly inaccurate. If you detect mold in an air test, you can't make mold up, but mold can hide, right? So in air tests, you can get a lot of false negatives, because a lot of your heavier, more dangerous molds like Chitomium and Stachybotrys are not floating around in the air 5 feet high. They're generally falling to the floor or to surfaces very quickly, so they're not typically detectable in air testing. So if you're relying solely on an air test, you could miss some key molds that you're being exposed to. So make sure you have a good mold inspector who that can do air testing, but they should also be doing surface sampling testing. They should be doing something called MSQ-PCR. And among other things, they should be doing an investigation to look for water damage or existing evidence of microbial growth, not only in your home, but also in your air conditioning system. There's a lot to a mold inspection that's beyond the air test. So my point is don't rely on an air test as the sole means to identify whether or not you have a mold problem. If I'm going grain-free to heal my intestines and don't have any allergies to fruits and vegetables, but I get gas and bloating when I eat them because of already incurred damage, am I still okay to consume them with my protein without it interfering on the healing? Gas and bloating, yeah, it's okay. I mean, but you may, if you're having gas and bloating upon the consumption of fruits and vegetables, the likelihood that you have yeast or abnormal bacteria in your GI tract is pretty high. And so you might want to get that looked at or tested, because certain fruits and vegetables will feed the microbiome, will feed the wrong bugs in the microbiome. And that, yes, when you are feeding the wrong bugs, they produce toxins, endotoxins and mycotoxins inside your GI tract that can slow down your healing process and even sabotage it. Have fibromyalgia and gluten sensitivity, have brain fog most days, help. Fibromyalgia, definitely rule out mold. It's a major contributing factor in most cases of fibromyalgia I've ever seen. What could you use if you have an central nervous system due to a past brain tumor in the hypothalamus pituitary gland, which has given me epilepsy, seizures in the temporal lobes, and I also have Arnold-Chiari malformation. This has given me several autoimmune conditions. No, I would argue that hasn't given you several autoimmune conditions. Something else is giving you autoimmune conditions and may actually be responsible for the growth of a tumor in your brain. You have triggers. Triggers are not typically the tumor. Something helped the tumor grow. Arnold-Chiari is typically a genetic malformation, so not so much, depending on how aggressive your Arnold-Chiari is. But I would argue that cancer is end-stage autoimmune disease. And if you're saying the cancer caused your autoimmune disease, I think you might have it backwards. I would say the autoimmune contributed to the development of the cancer. So, if you're trying to figure all that out and you're confused, start with what we call the 4 fundamental family of triggers for autoimmunity. That's food, chemical exposures, nutritional deficiencies, and microbial imbalances. If you have those 4 families of triggers, and you understand what they are for you as a unique person, then you can remove those triggers and you can find clarity on your path to better health. Get with a good doctor who understands that and will test you for those things. Let's see here. Perimenopause, been experiencing body aches for 2 days. Any suggestions? I mean, it's kind of not a lot of information. I mean, body aches could be caused by a lot of things. If it's just been for 2 days, you could become, there's just a lot of different things that could contribute to that. Even beyond, perimenopause. So maybe clarify a little bit better in your question for me, and I can give you a better answer. How do I get dopamine conversion to norepinephrine? You make sure you have enough vitamin B, and you make sure you have enough vitamin C. And then you make sure that you're also, you're handling your stress. And what I mean by that is excessive stress can disrupt the catecholamine conversion pathways. That's what dopamine to norepinephrine is. So, stress techniques, meditation, prayer, consider sensory deprivation therapies. You might consider vitamin B5 and vitamin C as tools to help fuel and support the functionality of your adrenal glands. Those are all good places to start. What can I do to increase my phosphoethanolamine on my amino acid lab test? Well, I would say if you did a plasma amino acid lab test, probably wouldn't look at that deficiency as anything that is super accurate, um, because it's a serum test and it's not really reflective. It could be altered by your day-to-day diet. So again, maybe consider different type of testing. Again, it's hard because there's no context as to what kind of test you had done. This is any of you that are asking me about particular testing. You're asking me about something being high or low, and you don't give me the context of high or low where in your urine, in your hair, in your serum, in your plasma, in your cells. It's really hard for me because the different methodologies of testing matter tremendously. Can Gilbert syndrome cause brain fog? Yes. If so, how to prevent or reduce if possible? With Gilbert syndrome, it's just important to support the liver. That elevation in bilirubin, bilirubin is a yellow pigment that can store in your brain. That's why we will sometimes see if it gets bad enough, we'll see kernicterus, which is the yellow discoloration of the eyes. And certainly can start to, when you build up enough bilirubin, can start to influence and really damage you. So really supporting your liver. How do you do that? Don't drink, don't smoke, go to bed on time, get a good exercise. Don't do, check your medications if you're on a lot of medications that are processed through your liver. That's putting more stress and pressure on your liver. Support the integrity of your red blood cells. Things like omega-3 fatty acids, vitamin C, vitamin E, all help stabilize the membrane of red blood cells and prevent them from breaking down too prematurely. Remember that that's where bilirubin comes from, is from recycled red blood cells. So when those cells break open too quickly, bilirubin can elevate, and if your liver's struggling, it can't conjugate that bilirubin effectively, and it'll start storing and pigmenting your skin. Is cacao 70% not recommended by your diet? I think a lot of people overdo chocolate or cocoa or cacao. There's a lot of caffeine there, so it just depends. I do test a lot of people who are reactive to it. Not everyone is, but if you're following no grain, no pain, I don't recommend it. What can cause amniotic fluid to be low? Is it more than dehydration? Yeah, it's probably dehydration. That's what I would suspect. Depending on what the OB-GYN or what the midwife or whoever you're seeing, what kind of testing that they're running, but I would definitely ask them to run a full electrolyte panel to see if there's anything going on there. And then I would also certainly want to make sure that the person was consuming adequate fluid or eating adequate foods, whole, real foods with water. Remember, whole, real, natural foods contain a lot of water. Processed foods don't. When you process out of food and dehydrate out of food, and then you use that food as staple in your diet, you're actually diminishing the quantity of structured water that you get through eating food, and that can lead to low levels of dehydration as well. So I would look at all of those things in context. How much choline would be a good amount to take? It's different for different people, but you could start with, really anywhere from 300 to 1,000 milligrams a day. How about being exposed to mold? What do you mean, how about being exposed to mold? Give me context to what you mean by the question. Sodium and potassium tend to run low, even in blood. Adrenal and thyroid issues. How much potassium and what form is best? Any good chelate of potassium is fine. As far as quantitatively how much, that's a huge range. You can do it. Well, you can get your doctor to write you a prescription. Potassium over 99 milligrams is actually considered a prescription drug in the US. And so you can ask your doctor to write, if your potassium is showing up low, ask them to write a potassium pill for you. But potassium is easy to come by, beyond supplementation, it's easy to come by through foods. Fruits and vegetables are rich in potassium. Meats are rich in potassium. So fundamentally, when people have sodium and potassium deficits, how much are you sweating? And how much whole food versus processed food are you eating? Are you using reverse osmosis or distilled drinking water, because the sodium and potassium are pulled out of those, and it can contribute to lower levels. So I'd be looking at all those things. But as a general rule of thumb, if you're just supplementing potassium, ask your doctor to write the script. Any over-the-counter supplement's going to be limited to 99 milligrams per capsule. And 1,000 milligrams a day of potassium is as a supplemental to your diet is a real safe level to consider. Does a high carb meal deplete your whole vitamin C right away, or would it happen gradually with multiple days, weeks of bad eating? I would say multiple days, although there's some research that shows that it could do it right away, depending on how it stressed your system, depending on what you're referring to in terms of high carbs as well. Because you could eat a whole food with higher carbohydrate content that might also contain vitamin C and other nutrients. But if you're eating a processed high carb diet, you're going to deplete your vitamin C much more quickly. High sugar content is a form of stress. And especially, again, if it's processed, where you're eating the sugar and it's an empty calorie, and then your body has to use vitamin C and B vitamins and minerals to process that carbohydrate down. I have a suspicion that my medicine I was taking with sucralose severely damaged my gut biome. Antibiotics seem to help the fogginess, and I don't know how to restore it. Well, it's possible. Sucralose is chlorinated sugar, so chlorine is an antibiotic. So it can theoretically and potentially, I don't think there's been any research on this, but theoretically could diminish the capacity of microorganisms in your gut to flourish. I think there was a case report, a few studies on chlorinated sugar also having a contributory effect on creating thyroid problems, which could also lead to brain fogginess. But if antibiotics seem to help your fogginess, you should ask your doctor to run a microbiome analysis to see if you have any abnormal bacteria that could be playing a role in causing or driving up endotoxin formation and inflammation. Because the antibiotics, right, they target bacteria, so it's probably part of what's happening at least. Are there natural alternatives to tamoxifen? Both of the two estrogen blockers can be a big problem for a person I know being told needs to take one of them. So I'm not a big fan of estrogen receptor SERMs, selective estrogen receptor modulators, which is what tamoxifen is. Doctors will say tamoxifen for 5 years post-breast surgery or post-breast cancer as a standard of care, but there's no great data on 5 years versus 2 years versus 3. I just had somebody in my clinic this week. She had 3 different opinions from her oncologists. One of them was like, wanted her to be on it for 5 years. Another one was a little wishy-washy, and then the third one was like, well, there's no great data, so if you've already been taking it for 3 years, it's fine if you discontinue it. So there are standards of care sometimes that are created with a lack of scientific rigor and information, and then they just become the standard of care because everyone's doing it, right? It's just kind of like, remember the saying when you were growing up, your parents might have said something like, just because everyone's doing it doesn't make it right. Well, that happens every day, all the time in medicine, right? Just because doctors everywhere are doing it doesn't make it right. I mean, look at our healthcare system. In the US, what did we spend last year? $3.2 trillion. We have more disease, more heart disease, more cancer, more diabetes, more bone loss, more autoimmunity. And that's the standard, right? The standard and the expectation of what we do and the outcomes of our healthcare is crap. But everybody thinks it's the right thing to do, and it's the standard of care. And till somebody gets in there and analytically breaks it down and fundamentally discovers this is wrong, these are the things that you should be doing instead, everybody makes the assumption that because it's being done that way, that it's the right way to do it. Hence, doctors recommending tamoxifen post breast cancer removal and radiation, etc. I am a believer that it's not estrogen that causes breast cancer at all. Your natural production of estrogen has nothing to do with your breast cancer. Your exposure to estrogen mimicking chemicals does. Your exposure to plastics and phthalates in your cosmetics, your exposure to the variety of different pesticides and herbicides that have estrogenic modulating effects. These are what we call endocrine disruptors, and they've been around for over 50 years, and they're approved and they're allowed in our food, and they're allowed in our clothing, and allowed in our items without any great safety data testing. But if we look across the spectrum where these things are used, we have tremendous increases in estrogen-based cancers, but not because you're making too much estrogen, but because you're being exposed to too many chemical estrogens. So figure out a way to remove the chemical estrogens from your diet and your lifestyle. That to me is a far better empowering move than taking a drug that has a known potential to contribute to the development of autoimmunity, which is what tamoxifen can do. It can contribute to the development of autoimmune disease. Let's see here. How can I get intracellular testing if I am located in Ontario? Reach out to Glutenology. They ship kits to Canada. We do US and Canada. We don't do overseas, at least not online. If you were visiting me in my practice, we could do it anywhere in the world. But if you're buying it off of Gluten-Free Society, US and Canada are limitations for shipping. I was having severe daytime sleepiness and fatigue. All my thyroid tests came back normal. Recently, I stopped all grains and dairy, and my symptoms vanished. Can you help me understand this? Yeah, you're probably gluten sensitive, and gluten was damaging your immune system to the point you were creating antibodies against your thyroid, causing it not to work properly. Even if your thyroid test came back normal, I don't know what all tests that you had done, but it's possible that your thyroid antibodies are elevated, but your TSH, T3, and T4 are normal. And in that case, that's still going to impact the function of your thyroid. Now, it's also possible that gluten was contributing to an inflammatory cascade in your body that was robbing your nutrients. In essence, when you're inflamed, you need nutrients to put the fire out. And so now those nutrients can't be used to generate energy. So what happens for a lot of people is their nutritional gas mileage improves when they quit poisoning themselves. And I would argue that if you felt tremendously better cutting out grains, it's probably because you're gluten sensitive. You might consider a genetic test to confirm it, but but if you have enough confirmation just by feeling better through your diet, then stay the course. I've had elevated red blood cells for the last 4 years. Any idea on the cause? So in the last 4 years, but do you have any track record prior to the last 4 years, or did you just started recognizing it because 4 years ago you started tracking? There are conditions where we'll see elevated red blood cells like hemochromatosis, but then chronic dehydration can cause elevation in red blood cells as well. There are certain bone marrow abnormalities that can contribute to red blood cell problems. So, I mean, there's a number of different things that could do it. If you see a good hematologist, they could probably give you a better answer than I could speculate at. What does it mean when I tested low in copper inside the cells? Copper red blood cell test or intracellular? I don't understand your question. So you're saying your intracellular copper was low, but your zinc was okay? Generally, it means that you're low in copper. If you're testing intracellularly and you have normal zinc but low copper, then you're copper deficient, and you need to consider getting more copper into your diet. Yeah, so Lita says, sounds like vitamin C would be helpful, but in the past it causes me to get cold sores. Most vitamin C, Lita, is corn derivative. And a lot of people don't do well with it because it's corn. So get you a good non-corn based vitamin C. You can go to Gluten-Free Society. We have 2 versions. We have something called Ultra C, which is cherry based, and we have something called Detox C, which is wild African yam based. Which antibodies are associated with brain damage due to celiac disease? Yeah, transglutaminase 6 and GAD65. Yeah, both. There's also transglutaminase 6 is one that's been found in schizophrenics. So I think if you're referring to the earlier comments on that's the one that's been shown in a number of research studies. We've also found anti-gliadin antibodies in these individuals. So just anti-gliadin IgA is another type of antibody that's commonly elevated. Can high cholesterol cause hair loss? No. High cholesterol is not a cause of hair loss or alopecia. Harry, you should watch our show on hair loss. We did a whole show, really comprehensive, on hair loss. Maybe we can post the link up. So many supplements that help have rice flour. Why? Because they have poor design. Whoever they're hiring to design their formulation is trying to save them money. And rice flour is super cheap. It's garbage filler. It's also not good for people trying to be on a gluten-free diet. Rice flours like that also can be contaminated with cadmium and arsenic and lead. I can't speak for why they do it, other than they're probably trying to save money, because rice flour is a super inexpensive filler and flow agent, but it's a bad one, and I don't recommend it. Being vegetarian, what should I do? Well, I don't understand the question. Being vegetarian, what should you do about what? I would say if you're vegetarian, you might want to evaluate why you're vegetarian, especially if you're not eating any animal product at all. I don't think any human is suited for a vegan diet. Now, vegetarianism and veganism aren't the same thing, so maybe you're eating milk and eggs or fish as part of your vegetarian diet. But give me more context to the question, and I might be able to help you a little bit better. What supplements do you recommend pairing with mycobinder as a recovery from mold exposure? Alpha lipoic acid, R-form alpha lipoic acid. I recommend vitamin C. I recommend a good liver support formula that contains milk thistle or silymarin. I recommend high-dose omega-3 fatty acids, 2 grams at least of concentrated EPA-DHA. Those are all good places to start in regards to helping with mold exposure. I also recommend a good solid probiotic with Bifidobacter, Lactobacillus, and something called S. boulardii. As probiotics have been shown to, in many studies, to degrade mycotoxins. So if you're, out of the mold and you're trying to, get mycotoxins out of you, but also degrade them or biotransform them from being toxic in your body, these are all just good things you could do to support it. But number one, Alexander, make sure you're out of mold, because then none of the stuff will do anything if you're still living in it. Well, the carnivore, I guess you mean carnivore diet help rebuild the brain after oxygen deprivation. I mean, there's nothing special about the carnivore diet specifically for rebuilding the brain after oxygen deprivation. The question is what caused the oxygen deprivation? If the oxygen deprivation was caused by an injury or an accident or a stroke of sorts, then you got to figure out what was driving the inflammation that led to that consequence, that led to the oxygen deprivation that caused the brain damage, right, Tim? So, carnivore would help if what caused the inflammation was gluten or oxalate or lectins or other plant-based nutrients. If a person was allergic to certain things or sensitive to certain things, a carnivore diet might help in that regard, but it's not a cure-all. I know there's a tremendous dogmatic following of carnivore, well, carnivorites, I'll say, and that's not to discredit any of these people's experience. I think a lot of people, I firmly believe there are people that could survive on meat. I've seen people do tremendously well on meat, but I just also don't want to promote that diet as the end all be all for all things, because it's not. I see a lot of people do carnivore and feel worse and get worse. I see a lot do it and get better and feel better. So everybody's unique and different in that regard. How do you test or know if rice is affecting you? Look, if you're gluten sensitive, it's affecting you. Rice has a form of gluten in it called orzonin. It's 5% of the protein in rice is orzonin. So if you are being exposed to it and you're gluten sensitive, it's affecting you, even if it's labeled as gluten-free. I know that might sound as a surprise to many of you, because a lot of the labeling laws and a lot of the experts out there recommend rice as a gluten-free substitute. I don't. There's ample evidence in the literature and also in my 20 plus years of clinical experience that show that rice gluten causes inflammatory damage in people with gluten sensitivity. So if you want to test, go get gluten tested. Go get a genetic test for gluten sensitivity. If you come back and you've got positive markers, consider taking rice out. Or just consider finding a brand of supplements that doesn't poison you with rice flour, Laurie. Go shop at glutenfreesociety.org. That's what we do. We specialize in grain-free products for people to really try and navigate their health. Thoughts on high saturated fat diets? I feel great when eating animal fats, but people tell me I'm at risk. I also have no large intestine and can digest fats easiest. Look, I think if you feel great doing it, consider doing it. Listen to your body. Don't listen to people. People are full of their opinions, including me. But if you feel great doing it, consider doing it. And if you're concerned about the risks associated, I should say the risks associated with consuming saturated fats, according to mainstream nutritional dogmatic belief, is that saturated fats increase the risk for heart disease, stroke, heart attacks, cardiovascular disease, clogging of the arteries. I've yet to find compelling evidence that shows that any of that's true. There's not been any double-blind randomized placebo-controlled trials on diet control where saturated fat consumption was shown to cause heart disease. It's all corollary data. It's all epidemiological data. And if you look at a lot of the cultures that eat high saturated fat diets, like the Inuits, they didn't have heart disease. So a lot of that risk that we claim is associated with saturated fat diets, I would argue is misleading. And I would say that the predominance of risk really boils down to eating foods that aren't real, eating processed foods. Really good eating saturated fats from animal meats. And you're just trying to do preventative testing to understand, whether you have an actual risk, then, get with a good functional doctor who can measure things like homocysteine and C-reactive protein and erythrocyte sedimentation rate and MMP9. Those are all great tests to help you understand cardiovascular inflammation, because if you have cardiovascular inflammation, that, now you want to figure out why. But I would never just put saturated fat in the category of fat that causes heart disease unless you're talking about synthetically saturated fats. And that's what we call vegetable oil, right? If you remember the Crisco and the shed spread country crock nonsense that they pushed on us for the last 50 years or so as a better alternative to animal fats. And then what did we see? We saw heart disease and stroke go up as a result of those recommendations. I don't buy into that line of thought. What can help for brain health? Go back and watch the whole show on Tuesday, Holly. let's put a link up on the Facebook feed for Holly on the show from Tuesday. I mean, it's such a huge question. Go back and watch the show. There's a lot of things that can help for brain health. At what age does someone take supplements to strengthen bones? It just depends. You may not need to supplement to strengthen your bones. The best way to strengthen your bones is to stay physically fit and active as you age, because bone grows based on pressure. Now, you do need micronutrients to grow your bones. So if you've got a history of medication use, medicines can deplete nutrients. And so knowing that can help you more specifically target what nutrients or supplements you might want to consider using for supporting bone integrity. But at the end of the day, I don't just recommend randomly that you just, at the age of 50, you start taking a ton of calcium, for example. I think that advice is bad advice. I'd say if you're really concerned about your bone health, get micronutrient testing done, and then, adjust your supplementation and diet accordingly to support your bone health. Methylfolate or folinic acid, which is better? Neither, because they're not the same thing. Methylfolate is methylated folate. Folinic acid, it's slightly different. So it depends on the person. You could use either one, but if we're talking about what does your body use, what is the active form of folate, it's methylfolate. So if we're going to choose one over the other in terms of something being in a supplement, methylfolate would probably be a good choice. Is eating liver every day safe? Am I not overfeeding some nutrients? Depends on how much liver you're talking about. If you're eating an ounce or two, I wouldn't be so worried. If you're eating an entire liver on a daily basis now, we can start being concerned about things like vitamin A toxicity. But part of it is the context of quantity and how much you're eating. And if you're worried, and if you're eating a lot and you're worried about overdosing, then get some, consider getting some periodic testing done to make sure that doesn't happen. I take sertraline for anxiety for the last 2 years and have brain fog. Sometimes, is there anything to help with this without changing necessary SSRI that works for me? Julie, I would say, yeah, there are a lot of things that you could do, but it would be speculation. The bigger question that I would encourage you to explore would be, why do you need sertraline for anxiety? If there's something else going on in your diet or lifestyle that's causing or contributing to anxiety, and sertraline isn't going to fix that. It might be very helpful, and I'm not saying that that you should stop your medicine tomorrow. That's not what I mean. But I'm just encouraging you to explore the potential that you're missing something about what you're doing that's driving your anxiety. And a classic example of that we see is people eating gluten. I mean, gluten drives anxiety tremendously. And because gluten can damage the brain, there's a form of inflammation of the brain. That's what anxiety is. It's inflamed brain syndrome. And SSRIs can help symptomatically in that regard, but they do not resolve why the inflammation is occurring. And so the longer you stay on those medications without figuring out why your brain is inflamed, the greater the damage is going to occur to your brain over time. And ultimately, bigger symptoms can come beyond brain fog. So that's where I would say, look into that. You might consider using B vitamins in the meantime. If you're just talking about what can I do right now today that might help with brain fog, consider B vitamins, specifically folate and vitamin B12. There's a lot of research studies using those two vitamins with sertraline, and it is better for patients. They have less side effects and they have better outcomes. Does putting a good salt in your water replace needed minerals taken out through filtering water? It can. Depends on the quality of the salt, but yeah, it certainly can help when you're filtering with like reverse osmosis or distillation processes. Kersey says, copper needed for myelin sheath around the nerves. I'm drinking distilled water and taking zinc without copper. Could this be the reason for my tingling in my feet and balance issues? Or is mold exposure the reason? I don't know. You could get tested for copper deficiency, and that might help you conclude whether copper is contributing to your symptoms. You could also be tested for mold or have your home be tested for mold to help get better determination. But I can't guess at that. I mean, it's not really typical to see somebody taking zinc and drinking distilled water and just develop a copper deficiency just because. Zinc doesn't cause copper deficiency unless you're mega dosing it indefinitely. Now, if you're taking 150 plus milligrams of zinc a day, 6 months or longer, yeah, you do want to have some concerns around that copper because there's an ideal zinc copper ratio that has been studied, which is about 7.5 to 1. Some say 10 to 1, but newer research says 7.5 to 1. So ratio of 7.5. So for every milligram of copper, you want 7.5 milligrams of zinc. And that's if you're trying to take them in balance through supplementation. But again, it's not typical to see somebody supplementing with reasonable quantities of zinc causing a copper deficiency leading to that, what you're experiencing. I would suspect mold, just intuitively. What do you think about vascular dementia and doing all you can to reverse it? Do you believe it's possible, and what do you suggest? Gosh, that's such a huge question. I think the earlier you catch it, the more you're going to bring about improvement. But if you wait till somebody can't remember who they are and can't remember their relatives, you're not really going to reverse that level of dementia clinically. I don't think anybody's ever really made that claim. It's all about getting it early. And vascular dementia is largely linked to the diabetic component of the blood sugar component, and it's sometimes referred to as type 3 diabetes. So if you have vascular dementia, you should be treating yourself as if you're full-blown diabetic. And that means, rigid control over exercise, over sleep, over diet, over nutrients that regulate blood sugar like chromium and vanadium and magnesium, zinc, etc. Okay, we'll take one more here. Anemia symptoms. Wait, let's go back. Tested positive on ANA test. Don't know which type of conditions. Definitely have brain fog with fibromyalgia. Any suggestions? Yeah, you've got an autoimmune process. ANA is anti-nuclear antibody. It means there's an autoimmune process roaring through your body. That means you're inflamed. That means there's something that's triggering that inflammation, and you need to investigate for it, Nancy. Now, fibromyalgia, very commonly we'll see mold, environmental mold playing a role in that particular situation. But again, there's 4 other categorical triggers. Food can be a trigger, chemical exposures, nutritional deficiencies, as well as microbial imbalances. So work with a doctor who understands those triggers and can measure those triggers as they relate to you as a unique individual. Otherwise, you'll just be guessing at them and chasing your tail. But that's ANA. ANA is a marker that is indicative of autoimmune disease. And there's some research that went on at the VA hospital years ago, and that we now call this predictive autoimmunity, which is where they took blood samples that were 30 years old. So they had in their frozen banks, they had the VA hospital had blood samples from soldiers from 30 years ago. And so they pulled all these samples out that were 30 years old, and they started testing them for things like ANA. And when they found positive ANAs, they called up the person, because the military, kept track of where these people were. They would call the person up and they would ask them, did you go on to develop autoimmune disease? And the predictability of that was like 93%. So even though they were asymptomatic when they had their blood drawn 30 years earlier, if they had positive ANA, the likelihood of going on to develop a full-blown autoimmune condition was 93%. So that's why I say if you've got positive ANA, you want to treat it like as if you already have an autoimmune condition, even if you don't have a diagnosis. But because you have a diagnosis of fibromyalgia, I would treat it as such anyway. Okay, I got to wrap it up. Thanks so much for tuning in. Look, if you found this information helpful, do me a favor. Share it with somebody that you love. Share it with somebody you care about. Invite people to the show. We're here every Thursday at 12:30 for your questions. And this is a live Q&A. There's no prompts. There's no script. It's just you asking me and picking my brain. So I'm here every week for you. Make sure you invite others that can also take advantage of these shows. Also, make sure you join me on Tuesday evenings at 6 p.m. That's Central Standard Time for crash courses on nutrition. This Tuesday, we're going to be doing a deep dive on how stress impacts vitamin and mineral levels. So if you want to learn more about how stress can rob your nutrients and what are the impacts of that and how they can affect your health, make sure you join me Tuesday at 6 p.m. Also, come visit us at glutenfreesociety.org if you want to get more information about navigating diet and autoimmune disease. Sign up for our free newsletter there, and we'll send you a bunch of free information on that topic. And in addition, make sure you take advantage if you're looking to get your nutrient levels tested. This week we have a sale on our nutrient deficiency test. It's 15% off, and you can use coupon code CLARITY. We'll put a link up in the feed for you to take advantage of that sale. So if you want to get really dialed in on your vitamin and mineral levels, consider getting tested, save some money at the same time, and get that specific targeted information that might just be the game changer in your health and wellness journey. Thanks so much for tuning in. We'll see you next week for another episode on the Dr. Osborne Zone. Take care.